Hello, it's me Durga Pokral and my student ID is 22068412 and my topic is cultural influences on health behaviors in Aboriginal Australians. I acknowledge that we are meeting today on the ancestral land of Aboriginal people. I respect their deep-rooted connection to the land and their community, and I extend my respect to elders past, present and emerging. Today I'm going to talk about Aboriginal people, which are a vital cultural group in Australia. I'll also discuss about the impact of cultural belief on health behaviors, and we'll also discuss about different health conditions which are mental illness and cancer, and we'll also discuss about the effectiveness of current health policies on health illness and recommendation for improvement of different kinds of health illness. Aboriginal people are original inhabitants of Australia. Aboriginal peoples, which are about 0.5 millions, residing in Tasmania and mainland Australia. So they have a rich cultural history that encompasses several language, customs, and spiritual practices that are closely linked to the environment. There is a significant health inequalities despite of their rich cultural history. In order to overcome this gap, it is crucial to comprehend how their cultural beliefs influence their health practices. Now I'm going to discuss about the impact of cultural belief on health behavior and practices. The Aboriginal people of Australia have a strong cultural belief that impact their health-related behaviors and attitude. As integrated approach to physical, emotional, and spiritual well-being is frequently emphasized by religious groups. For example, Aboriginal population believe the social relationship, ancestral spirits, and the land are all related to health. Cultural belief plays a significant role in experiencing mental health illness. This belief may be delay in normal treatment process of mental health. Indigenous people overall mental health has been significantly impacted by the history of colonization, especially the trauma of the stolen generation and ongoing experiences with prejudice. Substance addiction, suicide, and several degrees of psychological suffering have all resulted from these events. But a lot of people are afraid of ask for treatment because of societal perception of shame and the stigma associated with mental illness. Similarly, for Aboriginal people, cultural belief have a major impact on their experience with and response to cancer treatment because cancer is seen to disturb the balance within the community and spirituality. It is frequently considered with considerable fear and shame. Due to the related embarrassment, people may choose conventional healing technique or put off revealing their disease, which may delay getting a diagnosis and receiving treatment. Now I'm going to discuss about the health issues experienced by the Aboriginal people. In Australia, there are different kinds of health disparities between the general population and Aboriginal and Torres Islander peoples. Cancer is the second most cause of death worldwide in Australia. Five most diagnosing cancer are lung cancer, breast cancer, bowel cancer, skin cancer, which are over 60% of all cancer diagnosed. Survival rate of Aboriginal population from all cancer is 48%, which is lower as compared to non-Aboriginal population, which is over 59%. Some of the variables that contribute to poorer outcomes are advanced stage diagnosis, limited access to therapy, and the other contributing factor is socioeconomic factor and geographical isolation. Um, Now I'm going to talk about the mental illness. Mental health is another important health issue in Aboriginal population. There are different types of mental illness which are anxiety, schizophrenia, suicidal ideation, depressions, substance abuse, etc. Among them, depression and anxiety in Aboriginal population have greater between 50% and 3 times higher for non-Indigenous adults. Whereas rate of substance abuse, which is about 12.2% in indigenous population, is as higher as compared to 2.6% of non-indigenous population. There are different kinds of contributing factors which are poverty, unemployment, low education, limited access to mental health services in rural areas, because of which the mental health people suffer from these kinds of mental illness for a far long period. So now I'm going to talk about the effectiveness of existing healthcare provision. The Australian government has introduced a number of programs to reduce the health inequalities that Aboriginal people experience. The National Aboriginal and Torres Health Plan 2013 to 2023 is a crucial framework that attempts to offer a throughout and evidence-based method for enhancing health outcomes. This plan places a strong emphasis on the value of community-led health programs, addressing the socioeconomic determinants of health and providing treatment that is culturally appropriate. So now talk about the cancer care. In order to enhance cancer outcome for Aboriginal people, programs like Aboriginal Cancer Journals strategy have been established in the field of cancer care, offering culturally appropriate support services at every stage of the cancer care process, from every early diagnosis and prevention of treatment and palliative care is major objective of this approach. Even though these initiatives have demonstrated promise in terms of enhancing patient outcome and experiences, resources constraint and accessibility issues are frequent problems for them. For example, access to specialist cancer treatment facilities may be difficult for many Aboriginal people living in rural places, and culturally sensitive care in metropolitan area may not be uniform throughout the healthcare system. These problems are made worse by shortage of indigenous health care professionals and the underfunding of the specific initiatives, which result in gap in treatment and worse cancer outcome than for the non-indigenous population. Mental care. The social and emotional well-being framework is significant effort in the field of mental health that aims to incorporate cultural conception of health into mental health care. This model acknowledges of Aboriginal and Torres Island people holistic perspective on health, which includes not just the physical health but also mental, social, and spiritual well-being in order to address the mental health crisis. In order to address the mental health crisis in indigenous community, it is imperative that culturally relevant mental health program and services develop. The social and economic well-being framework had led this process. However, there has been uneven application of this program, and many communities contribute to lack access to mental health care that is culturally sensitive. Now, I'm going to talk about the strategy for improvement. Improving cultural competency in healthcare. Ensuring cultural competency among healthcare personnel is a crucial step towards enhancing healthcare quality. This implies that healthcare workers, including physicians and nurses, are educated to recognize, honor, and collaborate with indigenous population traditions and beliefs. Healthcare professionals may give treatment and practice feel comfortable and respected by learning about indigenous perspective on health, particularly the significance of traditional healing methods. Indigenous patients are more especially for serious conditions like cancer and mental health difficulties where they are respected and understood. Another is expanding access to culturally appropriate services. Another vital strategy is to guarantee the availability and accessibility of culturally competent healthcare services, particularly in isolated and rural regions where a large population of Aboriginal people resides. Increasing financial for Aboriginal community controlled healthcare or healthcare administered by Indigenous people. These services are renowned for offering treatment that is more in line with the community's cultural requirements and values, which improves health results by reaching more need for patients to travel great distance for care. If culturally more Aboriginal Torres Island people will be able to receive the care they need. And recommendations are, I already talked about, is improve cultural competency among healthcare workers, expand access to culturally appropriate services, and focus on rural and remote areas. And the conclusion is, in conclusion, an integrated strategy that places a higher priority on cultural competence and accessibility in healthcare needed to address the healthcare inequalities that affects Aboriginal and Torres Island people. Even if the current programs have made progress, there are still large gaps, especially when it comes to providing mental health and cancer patients with care that is culturally relevant. Building trust, promoting early participation, and eventually improving health outcome for indigenous people can be achieved by increasing access to special services and improving cultural competency. And these are the references.